Hi, my name is Sunita Noob, and I'm here to talk to you about diabetes. According to Janice Laser of the Medical Surgical Nursing book, diabetes affects many body systems. It's the leading cause of blindness, and it also leads to a higher rate of hypertension, which leads to heart disease, and end-stage renal disease. It affects 25.8 million people in the U.S. The cause of diabetes is having too much sugar in your blood. So you either produce too much sugar or your pancreas isn't producing enough insulin. There's two types of diabetes. We have type 1 diabetes, which was formerly known as juvenile diabetes, which affects 5% of the diabetic cases. And we also have type 2 diabetes, which affects the other 95% of the population. Type 2 diabetes comes on slowly over time, and it's because your pancreas does not produce enough insulin. So to understand diabetes, we have to be able to understand digestion. So what happens is we eat the food. Our food is chemically changed into glucose, and then the glucose binds with the insulin that is made in the pancreas, and then that is carried into the cells for energy. The sugar that it doesn't bind with the insulin remains in the bloodstream, which causes the blood to be sticky and sugary. Diabetics, a normal blood sugar is 70 to 110 milligrams per liter. And if it's over 110, then it is hyperglycemia. And people with hyperglycemia, the signs and symptoms are increased thirst, headaches, trouble concentrating, blurred vision, and fatigue. And if it's under 70 milligrams per liter, then they get hypoglycemia, which causes confusion, heart palpitations, shakiness, and anxiety. To diagnose type 2 diabetes, it's usually diagnosed during routine blood testing like annual exams, or a routine blood glucose, like if you're having signs and symptoms of hypo or hyperglycemia, they'll do a random blood glucose test. And then if that comes back positive, where it's higher or lower than the 70 and 110, then they'll do an A1C, which determines what your blood glucose has been over the past 12 weeks. With type 1, however, it's different. With type 1 diabetes, your pancreas does not produce insulin at all, and therefore you have all this extra sugar that's left in your blood, and you usually get the signs of the 3 Ps, which is polyphagia, which is you're really thirsty, polydipsia, really hungry. I'm sorry, I confuse those. Polydipsia is you're really thirsty, polyphagia is really hungry, and then polyuria, which you use the bathroom all the time because you're drinking all the time. These type 1 diabetics, their blood sugar can be really high, like over 600, and that can lead to a coma. So risk factors, obviously for type 1, it's your genetic disposition because you're born with your pancreas not being able to produce insulin. And for type 2, you're overweight, you have a poor diet and a sedentary lifestyle. The treatment for diabetes is for type 1, you are given insulin injections because you don't produce insulin. So you have to monitor your blood sugars and then give yourself an insulin injection according to what your blood sugar is, and then diet and exercise because you want to be able to keep your blood sugar at a normal rate. The treatment for type 2 is you can use oral meds, and then if it gets bad, you also will have to use insulin injections, and you also monitor your blood sugar, and diet and exercise is also recommended. So the complications for diabetes, like I said at the beginning, you can lose your eyesight, you get hypertension, which can lead to heart disease or renal failure. And this is all because the sugar in your blood makes everything sticky. So it gets stuck in the small vessels, like in your eyes or in your kidneys or and just in your vessels in general, and that can lead to amputation as well. So it's important for diabetics, because they have poor blood flow and poor circulation, to take good care of their feet, because amputation is a huge risk for being diabetic. So it's important to keep your feet clean and dry, and to wear loose-fitting clothes. And if you have any signs and symptoms of like cuts on your feet or ulcers, to get those checked by the doctor, because the healing is usually pretty poor. So diabetes is a chronic medical condition that can be controlled through diet and exercise, but it cannot be cured. And the best thing for people to do is to control your blood sugar, to alleviate the signs and symptoms of blindness or hypertension, kidney failure, amputation, and or stroke.